Before we get started with our dissections, we need to make sure that we're safe. So make sure you have gloves, lab coats, and goggles. To start our dissection, get your pig and place it on your surface. Now this pig's already been used for 2 dissections, but we're going to continue using it so we don't let any of it waste. Now we're going to focus on opening up the thoracic cavity and dissecting the heart. In order to do this, we have to perform a couple incisions through the cervical region, one down the center of the sternum, cutting it in half, and then another one at the border between the thoracic and the abdominal cavities. Then when that occurs, we'll be able to open up the thoracic cavity and view the heart. So our first incision will be a Y incision from the neck down to the sternum. I'm going to repeat that on the lower side near the abdomen, but it's going to be a bit broader. Make sure we cut through those muscles and that skin. And now we're going to make an incision right through the center here. And we want to know where to stop. We're going to start here where our Y met. And then we're going to stop right where we feel that xiphoid process. So you can feel, so it's getting squishy, squishy, and then right there where it becomes hard, that's where we want to stop our incision. So make our cut. Right at the xiphoid. Now we will have to cut deeper because we have to cut through that bone, but we won't have to do it right now because we're just going to draw out our other Y. Here we want to feel along the thoracic cage, the ribs, and make an incision along those ribs. Then repeat on this side. Feel along those ribs. Bring that up here. Okay. So those are the cuts you're going to end up making. Cuts along the cervical region, one cut down through the thoracic, and then an inverted Y, separating the thoracic and the abdominal cavities. Now, this is the tricky part because we do need to get through the bone, but we don't want to cut too deep to damage the heart underneath. As we're open up here, let's see if we can open up the thoracic cage. We're going to grab through the sternum and the ribs, and we're going to pull them laterally to either side. There we go. So now we can see the heart. We have this connective tissue surrounding the heart there, and that's going to be the pericardium. You have a really nice pericardial sac. You can see that sac being pulled here. The heart's still fully intact in it. I'm going to come down here at the lower end of that pericardial sac and just cut it open. There we go. That's going to separate out everything from this diaphragm here, which is the separation between the thoracic cage, the thoracic cavity, and the abdominal cavity. And now we should be able to peel that pericardium open since we cut it. And we can see that heart. See the apex of the heart being framed in by our lungs here. Now our task is to remove this heart from its cavity and look at the inside. What we want to do is to cut high on the heart, but you have to be very careful here because you do not want to cut the trachea. Okay? You can come to the side here. You can see that there's a tube right inside this neck that has these little ridges in it. This tube is the trachea. We don't want to hurt that one. So we're going to come through here. We're going to cut these vessels high. And then we're going to cut them on the sides between the heart and the lungs, cutting away those pulmonary arteries and pulmonary veins that feed into the hilums and around the lungs. Cutting the descending aorta there. And now the last one should be our inferior vena cava. Now we're going to take that pericardium off, and we have our heart. Let's put this down. We're done with our pig. We can put that away. We can see our heart now is ready to be dissected. The atria are underneath these left and right auricles. The ventricles will then be closer to the apex. Up top we can see the pulmonary trunk, which will then split into the pulmonary arteries. Behind the pulmonary trunk, a little harder to see, we have the aorta, then the aortic arch. Let's take our heart, put it on its side, so I have anterior facing this way, posterior facing this way, and holding it carefully, make an incision down the center of the heart. Making sure that your fingers are away from the blade. With our heart dissected, we have the right ventricle, the left ventricle, and then a really nice image. We still have some silicone inside that atria, of the atria, these nice opened areas here. We can see valves and chordae tendineae. can see a lot of those chordae tendineae, and then a piece of that valve right there. And that's going to be the tricuspid valve. If we come over here to this side, you already have the chordae tendineae showing here. If we open this up a bit, it'll take us to this valve right there, which is going to be a piece of the bicuspid valve. So we see the valves, the atrioventricular valves. We saw the chordae tendineae. So if you look back here, we have the inferior vena cava, and that will then lead into the right atria on that side right there. With the superior vena cava, of course, being right here. But I want to cut open this pulmonary trunk. Looking down now, from a superior view, we have the aorta in the back. We have the pulmonary semilunar here in the front. Now, we can look down through that opening of the pulmonary trunk right there. You can see those tiny little valves. Those valves are the pulmonary semilunar valves. We have the same thing with the aorta. Little aortic semilunar valves. And that is the heart. This is a model of the dissection that we just did. We cut the thoracic cage, opened it up, and exposed the heart. We also cut the aorta, the pulmonary trunk, the superior vena cava, and the inferior vena cava, which is below the heart here. And we cut the connections between the heart and each lung at the pulmonary hilum. Then we remove the heart. Now, that heart, as we see, shows the pulmonary trunk, the aorta in the back, the superior vena cava, and the inferior vena cava. Also with the pulmonary arteries here and the pulmonary veins here. We can see the auricles, the right auricle here, the left auricle here. And then we cut the heart and opened it up. This would then show the right atria, the left atria, and small representations of the right ventricle and the left ventricle. This also shows the tricuspid valve with the chordae tendineae and the bicuspid or mitral valve with the chordae tendineae. If we look at the base of the pulmonary trunk, we can also see that semilunar valve that we exposed. And we can see another one at the aorta, the aortic semilunar valve. Hope that helped.